Video is a quick introduction to the proper positioning for a chest decubitus radiograph, right lateral view. In order to successfully accomplish this examination, we're going to be utilizing a 14 by 17 image receptor placed portrait or landscape based on body habitus. Let's go ahead and have our instructors demonstrate the proper steps to successfully accomplish this examination. Having the patient laying down on their side. For this specific examination, we are going to demonstrate a right lateral decube. Therefore, the patient will be laying on her right side, and the left side should be faced up. You're going to place the 14 by 17 image receptor within a grid, and that grid is going to be placed behind the patient. Here we see our instructor placing the grid holding device behind the patient. And you're going to want to make sure that you place a lead shield apron in front of the patient so that the shield lays between the patient and the radiation source. Once the image receptor has been placed within the grid, you will place the grid within the grid holder and place the grid and grid holder in the back of the patient. The mid-sagittal plane should be aligned with the center ray to the grid with absolutely no angulation. The patient's chin should be raised, and both arms should be also raised above her head to clear the lung field. The back of the patient again should be pressed firmly against the image receptor, and the knees should be flexed slightly in order to maintain the coronal plane parallel to the image receptor with no body rotation. Here we have our instructor relocating the X-ray tube in order to have it running perpendicular to the image receptor. Make sure that when you're doing this, you're paying close attention to not turn on the light field while moving it so that you do not blind the patient. The source to image distance for this specific examination should be 40 inches source to image distance. A left letter marker should be placed upon the patient's left side, and the center ray should be horizontal, directed at the center of the image receptor to the level of T7, which should be 3 to 4 inches inferior to the level of the jugular notch. A horizontal beam must be used to show air fluid level or pneumothorax. Here we have our instructor placing the letter marker. In order to successfully accomplish this, you're going to make sure that you expose on the second full inspiration. Collimate on all 4 sides of the area of the lung fields, top border of light field to the level of the vertebral prominence, making sure not to collimate too much and clip the area of interest. After you have given the patient the proper breathing instructions, you may tell the patient to hold still while you obtain the image. After the image has been obtained, you may tell the patient to relax and breathe, at which point you will enter the room, remove the image receptor from the grid holding device, and run it through the processor in order to acquire the radiographic image. This concludes how you would obtain the image for a right lateral chest decubitus. Keep in mind that this is demonstrating a right lateral decubitus. It will be a different layout if you were to be obtaining a left lateral decubitus. Here we have what a right lateral decubitus should look like in a in a radiograph, you should be able to see the heart at the center of the image receptor, as well as a left and right lung. If taken correctly, you should be able to see an air fluid level in the top portion on the top lung. This concludes a video introduction to proper positioning for chest decubitus right lateral.